means an infection of the bladder, which is called cystitis. Could be an infection of the urethra. Do not mix between ureters and urethra, which is called urethritis. And the infection of the prostate in males, which is prostatitis. So this is urinary tract infection classification according to anatomical location. The second classification is based on risk factors. Okay. Now, uncomplicated UTI. First of all, uncomplicated UTI only happens in female patients. If a male patient has a UTI, it's classified as complicated. I don't care if they are healthy or not healthy. Okay. Now, uncomplicated UTI only happens in females, but what type of females? Okay. With the following risk factors or following past medical history. They have to be immunocompetent, which means healthy immune system. That means no diabetes, no comorbidities, no HIV. They have to be premenopausal, non-pregnant. So if you hear a pregnant female patient presenting with a UTI, you should classify that as a complicated UTI. It's no longer considered uncomplicated. Also, uncomplicated, a female patient who is immunocompetent with no anatomical abnormalities. Of the urogenital tract. No anatomical abnormalities of the urogenital tract. Complicated UTI. Again, any UTI that happens in men, we right away classify it as complicated. Any UTI that happens in pregnant patients, it's considered complicated. UTI that happens in post-menopausal female patients is considered complicated. UTI in children is also considered complicated. Who else would be considered a complicated UTI? Okay. Any patient that has risk factors which make them susceptible to antibiotic therapy. What type of risk factors that would make them fail antibiotic therapy? Okay. People who have anatomical abnormalities like a benign prostatic hypertrophy, BPH, some type of obstruction or a stricture. Okay. UTIs that go beyond the bladder, that become that lead to sepsis, which is wide systemic infection, or even the ones that go to the prostate. If a patient has a past medical history of urological pathologies, okay, like a kidney stones or kidney cysts, these are cysts that are gross anatomically found on the kidney. They're literally like cysts, okay? Patients who have a past medical history of renal failure, some type of renal failure, acute or chronic renal failure. Diabetics, UTI that happens in diabetics, or immunocompromised patients. A UTI in a diabetic patient or a UTI in an immunocompromised patient, right away it's classified as a complicated UTI. A UTI that happens in a patient who has recently had some type of urogenital instrumentation, like like a cystoscope, okay, or a urinary catheter. Patient who has a past medical history with a resistant uropathogen, for example, a type of pathogen that was not treated that easily with the typical antibiotics used for UTI treatment. And then finally, a past medical history of at least one episode of pyelonephritis in the last year. A patient who has had a pyelonephritis episode in the last year, and then they present again with a UTI, you would classify them as complicated UTI. So that is according to risk factors. Final classification is according to the source of infection, meaning where did it happen? Did it happen in the community or in the healthcare nosocomial setting? Community acquired UTI, this is a type of UTI that happened or is acquired outside of the hospital setting, and its onset is within 48 hours of hospital admission. The nosocomial UTI most commonly is caused by an indwelling urinary catheter. By an indwelling urinary catheter. Indwelling urinary catheter. Okay. And then we have another classification of UTI that's called recurrent UTI. Now, not any patient would fulfill this criteria. There are specific criteria for this. Okay. And the criteria is that if the patient